Hi everybody.
Hey guys.
Welcome to episode 6 of Healthy at Home. Today we're going to tackle everything literally about the knee. Now I'll tell you right now, just full disclaimer, I don't like the knee. I've never liked the knee. And there's a reason why we've left the knee to episode 6, because I try to avoid it at all costs.
Yeah, Kelly doesn't like the knee in practice. She's not big on knee.
Not my favorite. It's my least favorite joint of the whole body. Fun fact. So there you go. You've learned something new about me today. But we're going to wait for a few more people to join us, and then we're going to dive into all about the knee.
Yeah, if you guys are just joining us for the first time today, or you've missed a couple of episodes, you can catch all these episodes on our website now, gravenhurstchiropractic.com. Just go to the videos section, and we've got all the videos there for you.
Yeah, all 6 of them. So we've got quite a library now, and you can direct friends or family or those that maybe you want to rewatch it again, and you can just find them easily under the videos tab of our website. So to begin, we'll dive into this knee.
Yeah, Kelly hates the knee. She just said that. Yeah, the knee's bad. But
I know, bad news. And there's a reason. I'm going to tell you. I'm going to tell you why I don't like the knee, and maybe I'll have a few followers that will agree with me on this. But there's a reason why I don't like the knee, and it's because it's so sneaky. It's a sneaky knee. And there's a reason why it's sneaky. It's because pain of the knee can come from within the joint, or it can come from outside of the joint. So you have to be like a detective to figure out where it's coming from. So here's an example. A few episodes ago, we talked about the lower back, and sometimes conditions of the lower back can irritate the surrounding nerves that come out and run down the leg going through the knee. So people may come in with knee pain, but it's not the knee, it's coming from the back. Tricked ya, right? Or how about this? Sometimes we have issues with the mechanics of the feet. The arches are too high or too low. Over time, this creates irritation at the next joint at the knee. So people will come in with knee pain, but again, it's not the knee's fault. It's the foot and the ankle's fault. So again, trick. So aside from that, there are legitimate things that can happen within the knee. But let's talk a little bit about the knee itself. So we've got your femur here. This is one bone. We've got your tibia, your fibula, and your patella, which sits on top. So there's 4 bones that comprise the knee. Underneath that lies a series of other structures. We've got ligaments, which are supposed to hold the joints together, the bones together, and also provide some degree of stability. And some of you may be familiar with your anterior cruciate ligament, which is otherwise known as your ACL. That's a common injury point. We also have something called the meniscus. And the meniscus is a cartilage structure that lies between the 2 bones that should provide some shock absorption. Again, subjected to a lot of injury and impact. And then overlying these structures, we have big muscles like your quadriceps, your hamstrings. Then we've got other muscles like your calf muscle coming up from above. And then we've got a series of tiny little muscles which are responsible for rotating your knee. And some of them cross the joint and some of them go up and down. And it's a very complicated, messy little area. But the big take-home message here is that this knee is so vulnerable. If you step back and have a look at this knee from a bigger picture, you can see just how unprotected this knee is. And this is why it gets a bad rap in my books, is because it gets a lot of forces. Now just have a look here. Here's one injury. Look at this sport player, of course, football player, but many sports you'll see there's a high injury rate, frequency rate of knee injury.
It usually involves twisting. Twisting where the knee gets pushed inside, which can cause damage to not just one structure, but many structures.
Yes.
So we can tear the anterior cruciate ligament, which causes a stability problem. We can tear the meniscus, and we can also tear the medial collateral ligament. So many times people will come in with a sore knee, but it's more than one problem, and a lot of times it can be called the unhappy triad. Mm-hmm. So this is where you are not in the chiropractic clinic, but you're off to the orthopedic surgeon. But for the most part, we don't want to end up in that issue.
And you don't have to be a football player or any sort of professional athlete to have a meniscal injury. In fact, some of our listeners here today do have a legitimate meniscal injury, and that's because of a pivoting or a twisting injury. So we have a weight-bearing joint, and we're twisting on that. And that can create a meniscal injury, which is characterized by swelling, pain, of course, locking, and that sensation that your knee is going to give out. So that's a very, very common injury that we see as a meniscal tear.
So a lot of knee injuries are, traumatic. So you have tears from sports, you can have an injury to the knee directly from soccer or basketball or hockey, but some of it's acquired. Now, acquired knee injuries means that they happen over our lifetime, not because of anything we do, but mostly how we walk. So what we're going to talk about in just a minute here is the biomechanics of why people develop knee pain, which ultimately ends in a knee replacement or arthritis.
So to delve more into that, we're going to talk about not only, we touched a little bit on the trauma of the knee, but let's talk about the misuse or overuse injuries of the knee. So as Dr. Mike mentioned, the misuse is what we call is when there's an imbalance of structures, presumably muscles around the knee, that should create a nice sort of a pulley effect. And when one side gets tighter and one side gets weak, we get this imbalance happening at the knee, and we usually get inside of the knee pain. But we can also have an overuse issue where we have outside of the knee pain, and that's called usually your IT band syndrome. And that's because of repetitive overuse, cycling, running. This creates friction at the insertion point, and then people will come in with outside of the knee pain. So to delve more into all these mechanics and all this juicy stuff, Dr. Mike's going to talk all about that stuff next.
Okay, guys, so we're just going to flip the camera. There goes Kelly. So unlike Kelly, I actually like the knee. It's
Good.
an interesting structure.
Somebody does.
If it is the knee that is causing the problem, it's usually pretty interesting to treat. So when we develop, when people say I need a knee replacement or all of a sudden I have arthritis, it didn't happen overnight. It happened actually over many years, usually from a child. So when we step down and when we walk and when the foot meets the ground, if our foot comes in too far and it plants in or our arch collapses, you can see what happens with that tibia bone. The tibia twists in, that causes the inside knee joint to torque in, and it causes the hip to drop down. Now, that's accentuated a little bit, but if we do that millions and millions and millions of times through our lifetime, that's going to wear out the inside knee joint, okay? So if we come down and we're flat-footed or a pronator, which is 80% of the population, you'll end up with a knee replacement. And that's why there's like 2-year wait lists for knee and hip replacements, because it's such a common problem. How do we prevent that? How do we prevent that from a very young age, 9, 10 years old, even in our teenage years? We would use something called an orthotic. Orthotics are like glasses for your feet. As many people that are wearing glasses right now, including me, should probably have an orthotic. So orthotic is a custom-made device molded from your foot through a casting technique that allows support to the arch. So we put the orthotic in our shoe, and now we come down and we plant on the ground. The orthotic braces that foot. It helps absorb the cushion so we don't get that torquing, we don't get that tibia turning inward, so we don't wear out that meniscus, we don't wear out the inside of the knee, and it gets preserved. So if we get these orthotics on people at a younger age, usually when they're adolescents or they're in their early years, in their early 20s, and you do the right training exercises and you take care of the knee, you can actually avoid a knee replacement, okay? Another big thing for the knee that can make a huge difference is weight. We don't talk too much about weight, but when it comes to the knee, it's important. Being 10 or 15 or 20 pounds overweight dramatically changes people's symptoms. So if we get a patient in here who's got knee pain and they've gained like 15 pounds, simply dropping 10 pounds can dramatically change their weight. So it's important to maintain your proper body mass index and try to maintain a proper weight to help preserve the knee joint, because it's a shock absorbing joint that needs to be taken care of over a lifetime. Okay? So what would we do in the clinic when somebody comes in with either acute knee pain or chronic knee pain like arthritis is first we would probably treat with acupuncture to calm down the inflammation, calm down the nerves, increase blood flow to help with circulation and oxygen. Then we would maybe use ultrasound to help heal the meniscus by stimulating cell growth. We may use shockwave therapy on those tendons that have developed calcium in them because of chronic inflammation. We would use rock tape. Dr. Kelly's actually wearing the rock tape. So the rock tape is important to help lift the tissue off of the knee so that we can have blood flow under it to help heal it. Of course, we would use orthotics or prescribe orthotics or provide them to you to help brace that foot. And most importantly is we would check the function of the pelvis, check the function of the knee, the hip, and the ankle. If it's locked or not moving properly, we would use chiropractic adjustments to help restore the motion properly. But another important point is things you would need to do at home, like prescription exercise. So this is where the healthy at home stuff comes in, where you would get exercises from us through PhysiTrax that you would do to help strengthen muscles that are weak and stretch muscles that are too tight that create those imbalances around the knee. Okay, so for today, I'm just going to go over 2 stretches, pretty simple ones. I'm going to go over 3 strengthening exercises for the knee. This is by no means comprehensive. It's just simple stuff you can do at home to help take care of the knee and make it feel well if it's not acute and if it's not a serious injury. Okay, so for the first exercise, we're going to do a basic quadricep stretch. We know that the quadricep muscles get tight. If they get tight, they can cause the patella to track up and cause pain behind the kneecap. Okay, so we basically want to hold the end of a table. We want to take our leg, bend it straight up and back. We don't want to arch the back to jam up the low back, but we want to keep the pelvis flexed. And we just want to hold that stretch and feel a nice stretch through our quadricep muscle, holding it for 30 seconds and generally doing it 3 times. Okay. The other structure that can become very tight is the iliotibial band, or that band along the side of the leg that inserts into the knee. Okay, now this happens from runners. Now a lot of people say, they come with knee pain, they're like, I have to run, I'm addicted to it, I love the euphoria, I know my knee hurts and I'm wearing it out, but I want to run. We tell them, you can run, but you're going to wreck your knee if you keep on going. One thing that can replace running that the evidence has showed is exactly the same for cardiovascular benefit is using an elliptical. Elliptical trainer is perfect for the knee because there's no compression, there's no compressive forces to the knee. You can get the cardiovascular benefit and the euphoric high by doing an elliptical rather than running, so we would recommend that. Okay, but I'm going to go over the IT band stretch. So for this stretch, again, you would bring the leg up, you would pull it back, you would put the other leg on top of that knee, and then at the ankle you would just push down, and then you would feel that stretch along the IT band. You would hold that for 30 seconds and do it 3 times on both legs. Remember, even if you only have symptoms on one leg, you want to do it on both legs to make sure you keep a proper balance of stretching and strengthening.
And this plays into that whole idea that we were speaking about earlier about that pulley effect on the knee and the imbalance of muscles. So again,
Right.
Another reason why we want to promote balance.
So things get very tight in the knee, you get a tight quadricep muscle and a tight IT band. Things that become weak in the knee or become neurologically weak because of injury is the muscle on the inside of the knee called the VMO and the butt muscles called the glutes. So this muscle becomes weak, this muscle becomes weak, leading to instability and tracking problems in the knee. So in order to strengthen the VMO, we would do what's called as a TK exercise. So we go back in our arms, we would take the leg, turn it outwards, we'd raise the leg off the table about 1 foot, and we would draw a T in the air. Come back down, and then we would draw a K. So we're just trying to isolate that muscle on the inside of the leg. And it's actually kind of hard to do, even though there's no resistance there, just because it tends to be a weak muscle. So we want to do 3 sets of 12 on both legs, okay? So next we want to strengthen the glute muscles because they become weak, and if you have weak glute muscles, that can cause instability of the inside of the knee joint. So we would use a Perform Better green band, or a TheraBand band. We put it on the inside of our knees, here, and we would just line our back. And what's really important here is that you relax your stomach muscles, you relax your back muscles, you fire the glutes, feet shoulder width apart, and then you're slowly opening up your knees to about your shoulder width. And you're really trying to focus and almost meditate by focusing on those butt muscles because you need those to be activated and strong to help stabilize the knee. So you do about 3 sets of 12, taking a rest. A progression of that is to now raise your bum off the table, again relaxing the back, relaxing the abdominals, squeezing your buttock muscles up, doing a bridge. Now you're abducting. So you're opening up those legs again, a little more challenging, okay? A third phase exercise doing this is to again bend around the knees, coming up into the bridge, opening up, and now legs straight out. Down, bridge, open up, legs straight out.
Now, the band that Dr. Mike is using is something that we can order in for you. We usually have a supply on hand. It's a very small, unusual band compared to most that you may have seen, but it's specifically designed to go around your knees for this purpose, to strengthen the muscles of the hip.
So we've had patients who have just done those 4 or 5 exercises, stretching those 2 muscles and then doing the 3 strengthening exercises. And within about 2 weeks, they've noticed improvement in their knee pain by about 50 to 60%. That's without therapy or without anything. So exercises can be pretty powerful because you start to fire muscles that aren't stabilizing the knee. And once those muscles are firing and the knee's more stable, you have less pain. So those are the things you can do at home to help your knee. If you're interested in those exercises and they're too hard to follow on the screen here, we can always prescribe them to you on our PhysiTrax app. You can go to Gravenhurst Chiropractic and just send an email. We'd be happy to get them to you.
Or if you have other questions specific to your knee pain, feel free to reach out to us on our website. You can book a virtual care visit with us, and we'd be happy to discuss the intricacies of your knee and what you might require for custom exercises.
Yeah.
So thank you, everybody, for
taking the time to join us. Now, do you see why the knee's so complicated?
Yeah, it's a bit complicated, but it's fun.
It's a bit tricky. But
I like it.
Mike
Kelly
likes
hates it.
It's a love-hate relationship. Let's just put it that way. In any case, thank you for joining us. Since next Monday is a holiday Monday, we won't be doing any of our typical video series, but join us in 2 weeks' time when I'm going to tackle pregnancy and chiropractic. And in the meantime, if anybody has any suggestions or feedback or wants to hear about a certain topic, please comment below, like it, share it. We'd be happy to tackle any issues that you feel would be helpful for you or somebody you know.
Yeah, so have a great week, guys. Have a great long weekend, and we'll see you in a few weeks.
Thanks, everybody.
Thanks for joining us. Bye.